Welcome back. This is Lecture 2 of Module 1, and we're going to do a brief overview of the ICN Framework, so the International Council of Nurses Framework. The ICN Framework Domain 3 is the Incident Management System, which we just talked about. The Incident Management System refers to the formal structure used by countries, organizations, and institutions to manage disaster and emergency response and the actions required to make the structure effective. For Level 1, the general professional nurse, competencies focus on understanding and functioning within existing systems, so your hospital or your clinic. This includes describing the national structure for emergency response, using the specific disaster plan at your place of employment, and following the established chain of command. It also includes contributing observations to post-event evaluations and maintaining professional practice within your licensed scope of practice when assigned to an interprofessional team. At Level 2, the Design Disaster Responder, that'd be you, takes on a more active role in shaping and improving the system. This includes participating in development and organizational incident plans that align with national standards, contributing to post-event evaluations after real events or exercises, and developing action plans to improve nursing practice based on what was learned. Level 2 responders also integrate emergency planning guidance when reassigning staff or including volunteers. The critical concept for this domain is that effective incident management depends on understanding the chain of command and actively participating in continuous improvement through post-event evaluation. Remember that when you're reading the ICN framework, to keep in mind this is international. This is not specific to the United States. So you have to keep that in mind as you review this. Domain 4 focuses on safety and security. The goal is to ensure that nurses, colleagues, and patients do not add to the burden of disaster response through unsafe practices. Infection control is a key component. At Level 1, nurses adapt infection control practices to resources that are available. At Level 2, nurses implement alternative infection control strategies when resources are limited, with a particular emphasis on maintaining safety, especially in austere environments. Personal protective equipment, or PPE, is another major focus. Level 1 nurses use PPE as directed by the chain of command, and Level 2 nurses are expected to explain PPE levels and indicators for use. Proper PPE use protects responders and it preserves the workforce. Risk management is also central. Level 1 nurses report risks to their own safety, or the safety of others. And Level 2 nurses develop action plans to address and mitigate those risks. Finally, nurses at all levels assess themselves and their colleagues for support needs during disaster. Self-care is not optional. It is essential for sustaining your response capability over time. So, take care of yourself as well as the others you are providing care for. If you do not care for yourself, you will become a liability in the field. Domain 5 addresses assessment. This involves gathering data about patients, families, and communities in order to guide nursing actions during a disaster. At level 1, nurses report symptoms indicating an emergency. They perform rapid physical and mental health assessments, and they maintain ongoing assessment as the event evolves. At level 2, nurses take on a leadership role in assessment. They inform other nurses about emergency events and reporting processes. They develop event-specific rapid assessment guidance, and they integrate disaster triage into assessment, education, and finally, they identify and protect vulnerable populations. Disaster triage principles include rapid assessment, priority-based care, and focusing on the greatest good for the greatest number. Reassessment is ongoing, not one time. So remember, you're continually reassessing people. Mental health screening and identification of vulnerable populations are essential components. A key takeaway for this domain is that disaster assessment must address both physical and mental health needs. And if you remember from Lecture 1, one of the vulnerable populations that you need to make sure they are protected is children. But as the semester goes on, we'll talk about other vulnerable populations, and there are many others that I think will be important for you to know about and to understand. Domain 6 focuses on intervention. These are clinical and non-clinical actions that are taken in response to a disaster. Direct care interventions at both level 1 and level 2, including providing appropriate care within your scope of practice and adapting interventions based on conditions and resources. Resource management is critical. Level 1 nurses conserve and adapt resources, and they follow protocols. Level 2 nurses coordinate and manage resources to promote care delivery during the event. This domain also includes CBRNE response capabilities. So chemical, biological, radiological, nuclear, and environmental. At level 1, nurses participate in contamination assessment and decontamination. At level 2, nurses describe CBRNE exposure and appropriate decontamination methods. Another important competency is adherence to protocols for respectful management of the deceased. Even in disasters, dignity and ethical practice is essential. Domain 7 addresses recovery. Recovery involves helping individuals, communities, and organizations return to functioning and move to a higher level of resilience. At the organizational level, level 1 nurses assist in resuming operations at an event. At the individual and community level, nurses help patients, families, and communities regain functioning. Recovery also includes referrals and transitions. Nurses assess ongoing physical and mental health needs and connect individuals to community resources and support services. Personal debriefing is a required competency. Participating in debriefing helps identify personal and professional needs after a disaster. Recovery really isn't simply returning to normal. It's about learning, adapting, and building resilience for future events. And this includes you learning, adapting, and building resilience. Recovery isn't just returning to normal, it's building resilience and learning from the event. Domain 8 focuses on law and ethics in disaster nursing. Remember, this is going to be different based on your country, your state, the county you're in, the city you're in. Legally, Level 1 nurses practice within applicable laws and policies during emergencies. Level 2 nurses assist in developing emergency policies and procedures for other nurses. Ethically, Level 1 nurses apply disaster ethical frameworks to patient care, and Level 2 nurses help develop frameworks for resource allocation during disasters. A key ethical concept in disaster nursing is utilitarianism, which prioritizes actions that provide the greatest good for the greatest number of people. Later in this semester, I will get on my soapbox about utilitarianism and why I think it isn't the be-all, end-all of ethical practice in a disaster, but that'll come later. Level 1 nurses apply these principles while Level 2 nurses guide other nurses in their application. This approach can conflict with traditional nurses' focus on individual patient advocacy. Disaster nursing requires balancing the individual needs with the population level decision making. So let's talk a little bit about utilitarian principles. So it focuses on maximizing the population over the individual preference. It can guide triage, allocation of scarce resources, and withholding of care. It requires clear criteria and accountability to maintain the public trust. But enough for now. So on this slide, it basically compares the all hazards and the hazard-specific planning approaches. In the U.S., we tend to use all hazards approach. The all hazards approach prepares for core capabilities needed across any type of disaster. It emphasizes flexibility, adaptability, and efficient use of resources. This approach is cost-effective and broadly applicable across the workforce. The hazard-specific approach focuses on unique characteristics of particular disaster types. It requires specialized knowledge, tailored interventions, and detailed protocols. Best practice is an integrated approach. Effective preparedness programs use all hazards preparedness planning as a foundation and supplement it with specific protocols for likely threats. Disaster nursing behaviors in action, important for you to think about. So the slide basically illustrates how the ICN competencies translate into real nursing behaviors. Examples include rapid triage assessment using the START principles, adapting resources by training family members to assist with care, and using alternative communication tools when language barriers exist. Other examples include following the chain of command during evacuation, maintaining safety vigilance by monitoring colleagues' fatigue, and supporting recovery by screening for mental health needs and making referrals. These behaviors demonstrate how competencies become actions during a nursing response. So take a look at the rapid triage. Hopefully in the semester we'll talk more about START triage. We'll talk more about crisis communication. And we'll certainly talk more about resource adaptation. You'll have a whole module on the incident command, which will include chain of command. So this is a case study about hurricane response. So this case study applies the ICN framework to complex disaster scenarios involving a Category 4 hurricane. The setting is a 300-bed hospital experiencing power failure, flooding, and mass casualties. RN Alex is an emergency department nurse responding to the event. As the timeline progresses, challenges occur and that have overwhelmed triage. Worsened flooding, limited fuel, communication failure, staff fatigue, and delayed external resources. RN Alex applies competencies across the ICN domain, including preparation, incident management, access, safety, intervention, communication, recovery, and ethical decision making. This case highlights the importance of preparation, teamwork, and ethical reasoning. So let's walk through this a little bit. In the first 2 hours, the hurricane makes landfall. There are mass casualties that start arriving, and it overwhelms your triage. At hours 3 to 6, the flooding gets worse. The fuel for the generator is low, and your ability to communicate, your communication system is intermittent, which means your computers are going down, the phones are not working, the cell towers may be down. In hours 7 to 12, you expect help, but the help hasn't arrived. You're starting to have supply shortages, and the staff are getting tired. And then you get to days 2 and 3, where the roads are clear, the patient transfers can begin, and recovery plans start. So in the course of this event, you've used domain 1, 3, 5, 4, 6, 2, 7, and 8 in your planning. You're going to have a case study that you do later in the semester. So it'll be good to think back to all the domains and the domains that you could use when you come to that case study. So to conclude week 1, the ICN Framework, and this is version 2 of the framework, provides competencies across 8 domains of nursing and our function during disasters. It includes 2 competency levels. Level 1 for all nurses, and level 2 is designed for responders. The framework uses an all hazards approach supported by hazard-specific protocols. In the coming weeks, the course will move into specific disaster types, vulnerable populations, and practical skills and triage, and leadership and global health. The key message is that preparation today supports your effective response tomorrow. I hope you enjoy the course. I hope you will participate fully, and I look forward to meeting you as the semester goes along. Have a wonderful day.